Is our first evaluation work group of the year, and we are going to record it. It's kind of going to set the stage, but I think we'll have opportunity to invite some of your IAs to future meetings. Next slide, please. So not everyone most of us know each other, but not everyone knows each other here. So we're just going to take a moment to have everyone introduce themselves, and I'll go ahead and get started. We'll just pass it off to someone else till everyone gets to go. So I'll go ahead and start. I'm Amy Delicio. I'm the director here at the Center for Wellness and Nutrition, and I will be facilitating the meeting for you all today. And I'll go ahead and pass it over to Rachel.
Hello, this is Rachel Otter. I'm the Administrative Coordinator at Center for Wellness and Nutrition. Happy to be here and happy to support everybody.
All right, let's go with Jamie.
Hi, everyone. My name is Jamie Frederick, and I'm a senior research scientist at PHI Center for Wellness and Nutrition. So we'll be helping to work on this project. I will pass it off to Carla.
Good afternoon, everyone. My name is Carla West. I'm the Senior Director for Economic Security for the Division of Social Services, Department of Health and Human Services in the state of North Carolina. And I will pass it off to Kaylee.
Thank you, Carla. Hi, my name is Kaylee Carmen. I am a research scientist with the PHI Center for Wellness and Nutrition, and I am very excited to be working on this project. And Carla, I'm also working on a separate project in North Carolina, so hopefully we'll be able to connect about that as well.
Wonderful.
Awesome. I will pass it to Arnell.
Hi, everybody. My name is Arnell Wilson. I am the SNAP-Ed Director for the state of Mississippi, and I'm with the Mississippi Department of Human Services. And I'll pass it off to Latrice.
Thanks, Arnell. My name is Latrice Davenport. I'm the SNAP-Ed Coordinator for the Georgia Division of Family and Children's Services. And I will pass it to, I was trying to find a participant list. Nope, I can't find anybody. Kia Scott.
Thanks, Latrice. This is Kia Scott. I am from South Carolina, work with the Department of Social Services, and I'm the program coordinator for SNAP-Ed. And I think I may have been the last person. I am not sure.
No, I think you were. Thank you all for sharing, and we'll go ahead and move along. You all pretty much know us, but I'll say it really quickly. We are the Center for Wellness and Nutrition, a program at the Public Health Institute. We've been working in the Southeast region since 2015 on various evaluation projects, as well as supporting snacks and a few other things with the regional office. Next slide, please. We just introduced ourselves, but here is the main team that will be working on this project this year. Next slide, please. So today we're going to review the project scope and the timeline. We're going to talk a little bit with you all about SNAP-Ed and equity, make sure that we get your input. We are going to share our proposed SNAP-Ed evaluation framework indicators and sub-indicators that we plan to further investigate this year, and then we'll discuss next steps. We're a small group. We do have some interactive activities planned, but we can also just feel free to unmute and ask questions anytime as we move along. Next slide, please. And just so you know, we just putting this up, it's safe space here. And these are some guidelines around group agreements to use with many groups, but just to say, we want to hear from you, from your own experience. We're hoping that we can jointly seek understanding in this new topical area, being open and vulnerable, engage in dialogue, and be cautious of our language and tone. I don't think it's any problems here, but just sharing these general guidelines today. Next slide. So just to remind everyone about our 22 evaluation project focus, it is a regional evaluation, but only 4 states opted in. You all are here today and introduced yourself, but it is Mississippi, North Carolina, South Carolina, and Georgia. So things that we want to accomplish this year include identifying evaluation work group members. That would include the 4 of you, as well as any of your IA members that you'd like to join future meetings to help shape and review this project throughout the year. We'll have approximately monthly meetings moving forward. I think we'll be skipping December, but starting in January, we'll likely meet every month through September to ensure that we're keeping you all up to date and to stay on track with the project and have feedback loops throughout the project. We are going to start with a desk review of the SNAP-Ed framework indicators. That will include looking at the literature and environmental scan on the best practices to increase a racial equity focus within the framework. We're also aware that there are some parallel efforts happening within possibly ASNA and other agencies. So we will be sure to be connecting into those networks as well. And I'm sure some of you are connected also. Part of the plan is to survey nutrition educators to understand some of the current practices and if there are needs for tailoring approaches within the racial and ethnic groups served by SNAP-Ed, just to get their perspective. And this is really intended to survey people that are working directly with the population. So lower level staffs that are on the ground. Key informant interviews with leaders in SNAP-Ed or other related programs who have included a racial equity focus on nutrition, food security, or other evaluation metrics. An end result of the year will be a comprehensive report of findings that will include recommendations of ways to add a racial equity lens to these specific framework indicators. And this will also be shared, obviously, focused on our region in the Southeast, but this will be shared nationally to have understanding across other efforts happening in SNAP-Ed. It'll be shared with the regional office as well as probably SNAP-Ed headquarters. Next slide, please. Here's just a little kind of visual on the timeline on how we plan to work through this process this year. The desk review will be starting in December through January. And at our January meeting, we will plan to share kind of some of the findings that we do see. February and March, we'll be developing a survey as well as the interview guide and receiving feedback from the EWG. In April, May, we'll be conducting those surveys and interviews. June, July, we'll be analyzing the surveys and interviews. In August, we'll be presenting some of our formative findings and recommendations with a preliminary to get additional input, and then submit the final report at the end of September. Next slide, please. So we wanted to start out with a common definition to begin with of what do we mean by racial equity and how might that work into SNAP-Ed. So racial equity is the condition that would be achieved if one's racial identity no longer predicted in a statistical sense how one fares. When we use the term, we are thinking about racial equity as one part of racial justice, and thus we also include work to address root causes of inequities, not just their manifestation. This includes elimination of policies, practices, attitudes, and cultural messages that reinforce differential outcomes by race or that fail to eliminate them. So this is the definition that we chose to utilize as a common definition, and I'll just pause to see if there's any comments before we move on. All right, next slide, please. So thinking about as we get started, we wanted to kind of just get some ideas from you about what changes would you like to see in SNAP-Ed to better address racial equity. And we were going to draw, this is a Padlet link. We dropped the link into the chat. You can just go ahead, click the link on your end and go ahead and type some ideas into that Padlet, and we'll pull up the Padlet in just a minute. there's not a name connected to which you include. If that is of concern to you, it is anonymous, but we just want to get a sense of what changes are you wanting to see in SNAP-Ed to better address racial equity, and then we'll talk about how this project can start to um, ensure that we include some of those ideas as we start to address it through the framework. So we'll pause to give you a chance, and then we'll just pull up it. There you go. So go ahead, click the link. And then if you go to this link, you'll be able to type some things in. Let us know if you're having any difficulties.
Can you go back to that last screen with the QR? My phone didn't capture it, sorry.
Yeah. Rachel, can you pull up the QR code?
Can you see the QR code now?
Yes, thank you, I appreciate it.
No problem.
There's also, you'll see the little heart. There's also, you can also heart others that aren't yours that you are in agreement with. All right, so we're going to pause and just kind of review some of these together before we move on. And then if anyone's willing to provide some clarity, or if there's questions from the group, we will address those. So I'll just start reading them aloud and then maybe ask for clarity if needed. Support staff training for racial and disability equity, great. Pay participants for their expertise in directing SNAP-Ed programming. So I'm assuming that means paying stipends or other compensation to participants, which is sometimes hard to do, correct? Adding a racial equity metric in the SNAP-Ed evaluation framework, including community leadership development as the essential component of PSC efforts. I like that one. Tailor messages to include cultural perspectives. Click, okay, supporting staff training that centers community members in program decision making and ability to track metrics. Would anyone be willing to share what they meant by ability to track metrics? Is it, do you mean tracking metrics by race, ethnicity, or were you thinking of something else?
So that was me, and I probably didn't finish my thought very well, but I was thinking in order to make changes, you have to have a baseline metrics of where you are and whether or not those changes made a difference. So you would have to be able to track racial data to be able to see if the changes made a difference or not.
Okay, yeah. So kind of collecting race ethnicity data and basically measuring those changes or tailored approaches. Yeah, these are all important, and I do think we are some of these were in our mind as well, right? As we were thinking about this project. So I think there is opportunity to address some of these as we're exploring um, the changes in the recommendations to the framework as well as general recommendations. Something I see here is around supporting staff training or leadership, community leadership development, et cetera. And that is definitely something else that we've been talking about with the PSC. A lot of the MT 5 and 6 focuses on just the PSC, but it's really a lot of the process to get there is the really important aspect of ensuring that you're including community of voice and that staff know how to do that. So thank you all for participating in this activity that helps to bring us back to our PowerPoint. But before we move off this page, any other comments from the group?
Amy, I have like one quick question. So for this project, are we focusing specifically around participants and their voice in kind of the direction and decision making of the program? And we are gathering this information from nutrition educators.
Yeah, so I think we definitely want to include a community voice in that process. And we are I think we're trying to gather current practices from nutrition educators as well as get their input on ways to improve racial equity. I also believe that we're going to, reference the literature and other leaders that may already be doing it or other programs that have made adaptations. So all of that will be taken into account as we make recommendations for improvements. So I think, yeah, definitely we're looking to look at different sources to back up the recommendations as we move on. And Rachel, can you go back to the PowerPoint so we can kind of also share the indicators? I think that's coming up that we are planning to look at with this particular project, and we definitely want to get your input on that as well. Next slide, please. So what we primarily did was look at the indicators that we have already been measuring over time in the Southeast region and both, the regional 2017 as well as the 2020 evaluation, and also effort that has gone into validating survey tools and other data that we've been collecting. So we know that the benefit of this is pretty much every implementing agency is already doing something around these indicators. And we know that as part of different analysis and different projects that we have seen differences within results. So digging a deeper dive into these indicators also seem quite important from that perspective. So you'll see MT1 healthy eating, MT2 food resource management, and then again, the nutrition supports and the physical activity and reducing sedentary behavior supports. Next slide, please. Within MT1 and MT2, there are many sub-indicators, but we did, again, look at indicators that have been measured and that are widely used with implementing agencies across the region that are already being collected to have a better sense of the broad use of this. So under healthy eating, we focused in on the fruit and vegetable and beverage consumption behaviors. As we know, these are widely collected already, and we know there are some disparities within this data, even if we haven't seen it directly by breaking it out from racial, ethnic um, categories to date, because I don't think we've done it a little bit, but not totally. I know in some of the data we've seen here in California, we've seen great disparities within drinking sugar sweetened beverages. We also know that companies actually target Black and Brown communities specifically more heavily, particularly youth and young adults around sugar sweetened beverages. We also know milk is often has some cultural implications around, do people drink milk, and are we even promoting alternative milk sources? And then there's just this historic low consumption of fruits and vegetables, not meeting the recommendations. That's nationally. And also, we know there are some particular potential adaptations that can be done, thinking about access as well as types of fruits and vegetables that are being promoted, et cetera. Are traditional produce being promoted? Are they accessible? Are they affordable, et cetera? Then thinking about food resource management, we also chose a shorter list of those sub indicators, and we'd like to get perspective about these. But these are also ones that are commonly used. Many of them are part of Cooking Matters, which is a big curriculum that is implemented in the Southeast. But choosing healthy foods for my family on a budget, reading nutrition facts, labels, or nutrition ingredients lists. Um, a new one that we kind of are thinking would be a good one to add in is buying fruits and vegetables for fresh, frozen, dried, or canned. We do know fresh tends to be a primary focus, which definitely has benefits, but also digging in to see if we're promoting frozen, dried, or canned, or if that's something that our clients are more inclined to buy more of based on shelf life, et cetera. So it might be worth exploring that a bit more. Not running out of food before month's end, which is a big food security question, and shopping with a list. So these are the sub indicators within MT1, MT2 priority indicators that we want to explore more, and like to open it up to the group to just comments regarding this list, the initial list that we have compiled.
Hi Amy, it's me again. For these indicators, there might be states that have collected data on outcomes for these and have disaggregated that data by race or and ethnicity. Would that be a part of the desk review, is kind of reviewing what states or IAs are currently collecting and using to inform their program? And if so, do you want us to kind of send that to you, I guess, when this process starts?
Yes, I think that would be helpful, and I'll turn it over to my team in just a second. And I also know that some of the national population data is available, through the CDC databases or BRFIS and other national surveys. And that's another one that we can look at, which I know I've seen disparities from that. But I do know, Jamie, I'll maybe turn it over to you, that we were talking about deaggregating data within different states. And also one of our goals might be to, of this project, is to come up with a method for deaggregating and reviewing that data. Would you like to comment on that?
Sure. I guess, we are currently doing this process for the FFY 2021 annual report for Georgia. So I think we will learn some lessons from that process, but really good question, Latrice. I think you're one step ahead of us in thinking about, which indicators we would collect and then look at across the board. But yes, we can definitely consider that. And I think it's a great idea, especially with a comment about, looking at the baseline data, and you need that to be able to see trends or changes over time. So good point. But yeah, I'm not sure if data in the past has been disaggregated by race, ethnicity, but across the states. So I believe this is the first time Georgia is maybe doing that, but have other states done that in your annual report process to disaggregate outcomes by race or ethnicity?
Full confession from the state of North Carolina. This is Carla West. I will be honest and say I really don't know the answer to that question for North Carolina. I am sitting in as we currently have both positions in our FNS SNAP Ed vacant. And so I want to make sure that I understand this as we have a new outreach coordinator starting next week. So I really can't answer that question for North Carolina.
Okay, yeah, no worries. Maybe we can think about what questions we have for you as a follow-up to this call and then follow up with you all via email. So thank you.
Great. And then, yeah, and I think we can circle back on that question, like Jamie said, because maybe there are subsets of data. IAs are looking at different, race ethnicity outcomes in their programming. So we can follow up just to do a little bit bigger investigation on that. But I have not seen too much of that. I do know some states probably are doing that, so we can do a deeper dive to see what's happening there. But I think also the population level surveys can show us some of those disparities as well in some of these sub indicators. And we also might find in certain approaches or tailored interventions that we're seeing better outcomes for different race ethnicities. So those are all things we're starting to think about, but thank you for sharing and putting that also on our radar. Similarly, I know with some of the food resource management and work, there has been some changes made to some curriculums really based on trauma-informed strategies. So that's something else we might explore, specifically when we're thinking about not running out of food before month's end, and some of those more sensitive topics to ensure that we are addressing those. And also likely a recommendation would be to help to provide some additional resources to those families. So next slide, please. And then the next thing, as we started to think about PSC priority indicator areas, we did kind of end up pulling up ST5 need and readiness. Does that need and readiness fully address it? How do we include a racial equity lens in planning, implementation, and evaluation? And one thing I know that we've encountered even in our work is sometimes the readiness for small CBOs might not be as ready as a larger institution or organization, yet they are the entity that might have this most trusting relationship with the special populations that we're trying to serve. So there may be benefits to spending some time with those smaller organizations to build their capacity to be ready for the PSE changes just based on their trusting relationship with the communities themselves. Also, when we look at the ST5 need and readiness, you don't really see any thing assessing how is community voice part of that need, identifying need. Also with assessment tools, have we considered, who's conducting those? Many can be done in conjunction with communities themselves, or there can be a process in place. So that is something that we ended up adding ST5 back into the conversation, because by the time you get to the MT5 and MT6 indicators, we're already counting these changes. But how did we get to those changes? How were they selected? How were we ensuring they were written with this racial equity lens or focus? Because we even know that within policies, language matters. So how can we help to ensure that policies are written with a racial equity focus or lens or framework? So those are some of the things that we are thinking about as we start to explore the PSE strategies. and getting ready for the PSE strategies. I like that many of you in the past activity on Padlet noted this, like, how are we preparing staff? How is staff capacity being prepared? Are they, do they need to have certain training before they go out and do this around community leadership? I also saw compensation for residents. I think that's something that we definitely advocate for is fair compensation, but I do know we do run into challenges with USDA when we want to pay um, residents to help us implement PSE changes. And it's a little bit tricky for some of our low income residents to do that on their free time because, right, they're busy, they have one or two jobs, they may have children, and they may have other responsibilities. So it makes it very difficult for them to find free time to get involved with PSC implementation. So those are some of the areas we are considering exploring, but we'd like to open it up to, again, to you all regarding um, things that you're interested in as we're talking about PSC priority indicators. We also talked about reviewing the list of PSCs themselves and ensuring that they are accounting for um, some of these things, or does the list even meet the needs of the community? Are there other things communities are asking for that we should be aware of, et cetera? So I will pause now and just open it up for any comment or feedback or indication that you feel like we're headed in the right direction as we're thinking about how to dig deeper into PSC implementation. All right, I'm not hearing comments at this time, but that is generally where we will be exploring digging deeper in the literature, looking at other frameworks, because there are a few other ones out there that help you build in racial equity and equity along the way. Um, so I think a lot of this recommendations will be in the process more so than in actually how we're counting up PSCs, but there also might be some recommendations around the actual PSC activities themselves, as well as language within PSCs and system change. I think describing that a little bit more too. And there's always a recommendation to ensure that we're getting input from people that use those systems and that have historically been left out and that are most impacted by the systems themselves. So that's what we're thinking. Next slide, please. Great. So, and I'll just pause for a minute and just like, if you can use your reactions on the below and just give us a thumbs up if you're feeling good about the approach that we're taking with the indicators so far. All right, I saw a few thumbs up go up, so that's good.
I realize there's
Hopefully.
not a thumbs down though.
Oh yeah. Are there any thumbs downs or comments? I don't know. Yeah, there's all of the emojis are pretty positive over here, but if there are any concerns, feel free to share those with us now. Okay, so who should be at the table of the evaluation work group? So we feel that, the 4 state representatives will be part of that, but also would encourage you all to tap into your implementing agencies. to join the evaluation work group, and we'll have some instructions on how to do that so that they can be included in future meetings. We are recording the session today for that purpose. If you needed to share it back with anyone, as well as we can provide the PowerPoint slides also. Again, we'll be developing that survey with the nutrition educators, garnering feedback from this evaluation work group, and also working with you to help us identify the right leaders. We also feel like you all will be advisors throughout the project, and hopefully, like Latrice has mentioned, willing to share some of your data or look at things as we go along this process so we can really do some deeper analysis of what's happening now, and have some specific recommendations on how we plan to improve this. And although our final product is definitely a report with recommendations, we do hope that we can then implement some of those recommendations in 2023 and actually test them in the field. This is really a formative exploratory year, but we are hoping to do this. Yeah, and the other, oh, yes. So the other thing we were thinking about, this was part of what was in our original plan, but as we were planning and looking at this, we thought about potentially reducing some of the key informant interviews, since we will have such a robust group here with state representation as well as implementing agency representation, that why not set some of that time and effort or evaluation support aside to get some community voice embedded into this process as well. So we thought about ways that we could potentially do that, and which might include a survey that we could ask implementing agencies to administer with some of their participants, or potentially a few small focus groups, again, building off of some existing classes that might be happening in the region or in your states throughout this process, where we can get some checkpoints in with actual residents. So we have that input. I know some of you might have an advisory council of that sort. So we'd like to utilize some of those points into this process, even though it wasn't fully fleshed out in our original scope of work. We feel like we will have some access to SNAP Ed leaders here within our own evaluation work group, but we also would like to have some checkpoints, particularly towards the end of this process, to make sure we're getting a reality check by talking to some participants in SNAP Ed. So we'd like to open that up to you all to feel like if maybe reducing formal key informant interviews with other leaders and adding in a community voice component would seem to be beneficial, more beneficial to you all as well, or to stick with the original plan. All right, okay, good. I think incorporating community residents is important for this process. Thank you, Latrice. Yeah, we also thought so. I know it was a little bit tricky, as you guys know, it was between potentially going through USDA or the states for this project. And one of the limitations of being directly funded by the feds was we had very strict guidelines around reaching out to community residents without going through OMB clearance. So I think that's why it was carefully crafted out of the scope of work, but it was originally intended to be part of the process. And now that we're working through state agencies, instead, I think we have more freedom to open that back up. So Arnell or Dakia, Carla, any thoughts on, are you guys comfortable with us saving some space or time to ensure that we talk to some SNAP Ed participants before finalizing our recommendations? And you can either chat it, oh, good, or unmute. Yep. Okay, there you go.
This is Arnell. I would suggest giving me an opportunity to talk with my IA to see where the evaluator is kind of headed and get some input.
Okay.
But as far as I'm concerned, I think these are great. But let me just talk with them and maybe I can just shoot you all an email or whatever the case may be.
That sounds good. Thank you, Arno.
Thank you.
Thank you, Kia. So including community residents would be great. And Carla, it sounds like you have a new staff person starting next week. So
Yeah, I was just gonna say, while I agree with both of those, I think what would be really beneficial is once I get my new person started next week, maybe having a meeting with you all and them and talking a little bit more about the goals of this project so that we can make sure that we are fully engaged and knowing what to do. And I really apologize for not having a better grasp of what's needed here.
no problem. Thank you. And I think we'd be happy to meet with your new staff person. Great. And you're also going to discuss it with your IAs. And that's perfect because as you discuss it with your IAs, you may find that they will be interested in joining our evaluation work group for this new project this year. And that will be helpful to have more people involved and more brains, right? So we can really do a great job and represent the region well. Next slide, please. So just kind of sharing, as mentioned, our next steps will be to start to schedule those monthly EWG meeting times out, invite colleagues to future EWG meetings, and then we will select the SNAP at evaluation indicators. We will follow up with this information in an email. You'll have the recording. It sounds like many of you want to talk to your IAs and your staff before we make those final decisions, but we will go ahead and just start doing some of our desk review as we prepare. And it's a little tricky to host a meeting in December with the holidays coming up, but then we'll be prepared to host a larger meeting in January to start to get those. Feel free, like some of you mentioned, to email us in between time. We're willing to set up some calls individually with you if you need any further explanation or you want to talk anything out. But yes, we can stay connected in the coming weeks just to ensure that we're all moving forward on the same page and that we're meeting the needs for this project. Next slide, please. So we would like to request from you that if you could please submit your additional contact information from your state to our info@wellnessphi.org. So as you talk to your IAs and you find out folks that are willing, or your colleagues within your office, if you find out folks that are willing to participate in the EWG this year and help support our project, please share with us their first, last name, their email address, and organization that they'll represent. We will create a new listserv for the EWG that we can share out with everyone, but that way we can ensure that we have communication with the whole group and that they're added to the meeting invites as we plan those out. And then we also would like to do a quick poll with you to gauge when we should host these meetings. I know today we had the meeting a little later than we normally have in the past. We are planning to continue with the last Tuesday of the month because that seems to work for our internal schedules and based on some other commitments that we have on Tuesday. So go ahead, Rachel, and launch the poll. We wanted to get your input on if there's a better time. We typically have done these meetings at 1 p.m. Eastern, but there's also the option of doing 4 p.m. Eastern. So go ahead and as the poll comes up, just pick the time that you think will be best for you and potentially some of your partners that might join, because we will just move forward with one of these times as our standing time for the meeting. And then if you can't, for whatever reason, don't get the poll, because that occasionally happens, just feel free to type in the chat if 1 p.m. or 4 p.m. works better for you and your partners. All right, I see 1 p.m.'s in the chat. I don't know, it was the poll similar, Rachel? 1 p.m. Okay, everyone says 1 p.m. So we're gonna move forward with 1 p.m. And we're gonna set those up for the last Tuesday of the month. That does mean we won't meet again until the end of January, but please, we will be providing some email communication. Please do share with us your additional participants for this group. And if you need us to spend some time with you and your state partners or partners within your state, please ping us in between and we will try to get those set up before the next group meeting. We will go ahead, you will have the PowerPoint after this call as well, and you will see the indicators in the direction that we're planning to go. If there are any concerns about those indicators, please do let us know sooner than later, because we do plan to start doing that desk review and some work in December. So we're prepared to discuss our findings in January. So if anything comes up about some of the indicators that we have selected or some of the approaches, please do ping us and we can have a conversation because we want to get this going so we have something productive to share out in January as we meet with a larger group. And I do know, I guess Brittany was unavailable to join us today, but I do know she still does plan to join when she can. And she did indicate that USDA is very interested in this project and the findings that we uncovered together. So I believe this next slide, please, that this is all we had for you all today. Thank you very much. Feel free to reach out to any of us directly. We'll be happy to assist in the meantime to make sure this project moves forward. But I'll just pause if there's any final questions or comments prior to us ending the call today. All right, thank you so much for participating. And as mentioned, don't hesitate to reach out and we will be in touch with some of these follow-up items today. Thank you.